Hi, let's talk about a little bit of a switch flip in the way we think about health and sickness. So, there are two ways to think about a situation when you don't feel well. Let's take a diagnosis of diabetes, for example. You can look at it and you can say, how do I get my blood sugar numbers to come down? So if you visit mainstream medical practitioners or you follow standard of care, healthcare, you'll think, well, I can take metformin, I can wait until my insulin numbers get high enough, and then I can take insulin when I need it, or whatever drug it is to get that situation under control. But I think that is actually not the right way to think about this situation. I think a much better question to ask is, why is my blood sugar high in the first place? So you have to unpack this question from a different standpoint. It's not, how do I make a number on paper look better? It's, how do I make myself healthier so that situation doesn't happen anymore? And you can ask that question about anything from high cholesterol to high blood pressure, or diabetes, or cancer. Like with cancer, it looks something like this. Not how do I cut out a tumor or whatever. It's, how do I create an environment in my body where cancer cannot grow, thrive, and live and exist and develop pathways to spread and all of those things. So I think that is just a paradigm shift in the way we think and the way we do healthcare, because quite frankly, a lot of what we consider to be healthcare in this country isn't healthcare. It's sick management or sick care. And so that's, I love to have this conversation with people, because so many people have never thought about it that way. They're just like, oh, well, I'll just wait until I have some thing that they can look at on paper and diagnose, and then I'll just take a medicine to make it go away. But it doesn't work like that necessarily. I think a better strategy is to say, how do I build health so that I don't have these warning signs, or check engine lights, as I call them, popping up in your body? So anyway, that's functional medicine. That's the type of healthcare that I do. And, if that's what you're looking for, seek out people that align with your definition of healthcare. And don't try to figure out how to squeeze into a broken healthcare system. Figure out how to make what you want happen. Because I see so many people, what they want is that kind of functional healthcare, and they just don't do it because they think, well, my insurance isn't covering it and I can't do that. There are ways to get what you want and what you deserve if you just think about it and pray for doors to open and look for new ways to approach it, and really look at it in terms of investment. You can invest in it now, or, a lot of times when you don't make that investment now, it costs a lot more later. And even if you have insurance, it's still just a horrible thing to wait until things are really bad, diagnosable problems. So anyway, just a little bit of a thought shift. And I thought that might be interesting to talk about, because so many people, they've never thought about it that way, but they are looking for someone to partner with them to deliver functional health care that is about how their body is working and what it is doing and how it's behaving, not what are the symptoms and what's that number say on a piece of paper. But anyway, I hope you found that useful and helpful. Have a great day.